Hi everyone, I hope you're having a great day. My name is Clark, host of Intelligent Beauty. Today we're talking about under eye bags. Now one thing I've noticed is that under eye bags really plays a tremendous amount of people. Under eye bags can occur for many different reasons. There's always a genetic component. Either your mom or your dad or someone within your linear tree has those under eye bags or under eye hollows. If you're over exercising and you're draining the fat, you're burning so much calories that you're taking ounces away from the face, those fat pads can shrink, causing gaps between the fat pad boundaries. That's right. So there are fat pads in the face, and these fat pads are lining the face like bundles in specific areas that gives us cheeks, mid cheeks, lower cheeks, upper cheeks, nasolabial fullness, temple fullness, zygomatic fullness, jawline fullness, masseter fullness. So there's fat all around the face in different pockets. And these fat pockets or fat pads are lined with a septum that holds them in place. So imagine different shaped cushions within the face to create volume. So we have the upper cheek, mid and lower cheek fat pads, superficial, intermediate and deep layer malar fat pads. We have fat pads lining the sides of the face and above the parotid glands. We have fat pads in the mandible region, temple region, forehead, glabellar zone, all around the eye, the nose, the lips. These fat pads lend to youthfulness within the face. And as these fat pads are shrunken or reduced or get softer with age and drops, it creates hollows in specific areas. And that's why most people age in a predictable manner. If you look at your parents or anyone within your family tree, you'll find that there's some characteristic changes in the face as they get older. Are you going to look like your parents and so forth as you get older? There's a strong possibility you are. But remember, there's a combination between mom and dad. So that combination, you will have some from mom, some from dad. Back to under eye hollows. When we lose some of this fat, or this fat gets shrunken, or drops, or decreases in size, then these hollows can become significant. Also, there's muscles in the face. As we get older, muscles shrink, they atrophy. And as these muscles atrophy, it creates more spacing within the face. The fat pads are not necessarily sitting on that muscular structure as firmly as it used to. Also the bones. So the bones in the face get smaller as well. If you look at your parents, the head circumference is a little smaller. They're a little shorter than they were because bone reduces in mass and size as we get older. So this could be in the 30s, 40s, or 50s. But as the bones get smaller, the fat shrinks, the muscles get somewhat smaller and atrophy. What happens to the skin? The skin doesn't shrink, but the skin drapes the face. And as the skin drapes, you get some hooding of the eyebrows. Under eye hollows come in higher. Infraorbital fat pads become slightly herniated. Most of the fat pads in the lower face, as they're shrunk because there's not too much bone within the mid face, they become more hollow. The jawline becomes a little smaller, so the skin drapes. Nasolabial folds become thicker and heavier. Lips become smaller. Mental creases occur. So all of this occurs with age. For some people it's more, some people it's less. But getting back to the under eye fat pads and the treatments, there's only one real treatment that I believe in. There are different treatments that can be done under the eyes. One of those treatments is surgical intervention, where we can laser or we can actually take some of the fat padding out. The problem I find with that is as you take the fat pads out, sometimes you can create more hollowness for the patient, and the patient would require to use more fillers to create a smooth fullness under the eyes. Another treatment that can be done are fillers. Fillers are used to line around the fat pads and create the volume that was lost or the volume that you never had under the eyes. There are other skincare topical treatments that are used, but these are not as significant as surgery or non-surgical injectable fillers underneath the eyes. We do not use silicone under the eyes, that's the worst, and there are many fillers that are not great under the eyes. In my opinion, of all of the fillers available in the US market, there's about 3 fillers that are good treatment choices for under the eyes. So there it is, under eye treatments using hyaluronic acid fillers, which is either a combination of or individually Restylane HA products, Juvederm HA products. These are the 2 better brands with the better products to treat under the eyes, in my opinion. And I've been using these products for many years, and I can definitely tell you that the under eye treatment is not the easiest, but you can get consistent results. You can be happy with your clinician if they have the necessary education and training that's required to get consistent improvement of treatments under the eyes. Thanks for listening again. Please subscribe, hit that notification bell. I will bring other treatments to you in the near future.